Lacey Thomas, and my topic is amyotrophic lateral sclerosis, also known as ALS. So, what is ALS? It's a fatal progressive neurodegenerative disease. What that means is both the upper and lower motor neurons are dying, so that connection between the brain and the muscles is being severed, and it presents with muscle weakness and atrophy. It could either start in the arms and legs, and that's called limb onset. It could start with swallowing and speech. That's called bulbar onset. And rarely it can start in the thoracic cavity, and that's like your diaphragm, and that's called thoracic onset. No matter where it starts, it all leads to full paralysis and eventually death within 2 to 5 years. Who can get ALS? So this is actually my mom in the middle in the white. Um, she has been living with ALS for 7 years. It's most common between the ages of 40 and 70 years old. Um, it's more common in men than women, and about 5,000 people are diagnosed in this country a year. 90% of those cases are idiopathic, like my mom's, meaning there's no known cause, and 10% are familial. There's actually a genetic connection between 10% of the ALS cases. Um, Something I wanted to note here is even though my mom's considered idiopathic, there's also a weird connection between military members and ALS. If your military members are more than two times as likely to get ALS than a civilian, no matter the branch or how long they've served, so much so that it's considered a military caused disease. So there's nobody understands why yet, but there is a connection there. So some associated conditions with ALS. Obviously, there's respiratory insufficiency, trouble breathing. Eventually, somebody with ALS will need to choose whether to get a trach or not. Pseudobulbar effect it affects some people with ALS, not all. That's when you laugh or cry at inappropriate times without meaning to. There's medication to fix that. It's essentially damage to part of your brain though that ALS can cause, or you can get it through another way of getting brain damage. Orthopenia is trouble breathing laying down. Frontotemporal dementia, I'll get more into this in the language and cognitive conditions section of this slide, of this presentation, but essentially it's more brain damage to a different part of your brain that can cause forms of dementia or aphasia. And then also inability to complete tasks associated with daily living. Obviously, if your arms and legs aren't working, you can't shower yourself or feed yourself. So speech disorders connected to ALS, dysarthria, slurred speech, when those articulators start becoming paralyzed, that sets in. Excessive saliva can affect the way you sound, and hypernasality is when that velum doesn't constrict and air escapes through the nose, affecting your resonance. Dyspnea is shortness of breath, and breath powers the voice. So if you're having a hard time breathing, that's going to affect your speech. Swallowing disorders with aphasia swallowing disorders with ALS include dysphagia. Excessive saliva also affects your swallowing, and eventually alternative feeding methods will be needed, such as a feeding tube. A patient with just ALS is going to have typical language abilities, but that frontotemporal dementia I was talking about earlier, up to 40 to 50% of ALS patients um, can develop FTD, and that can cause forms of aphasia, which is a language disorder. Same with cognitive disorders. ALS patients with just ALS are going to have typical cognitive abilities, but if they have FTD, they're going to have problems with memory, reasoning, and judgment. ALS does not cause any issues with hearing. So for assessment, you're going to assess resonance for that hypernasality, articulation, respiration, and for swallowing, that modified barium swallow study where the X-ray with the food coated in barium to detect aspiration. Treatment for speech, you're going to might use a alternative communication device such as an eye gaze computer, and then for swallowing, you might do the chin tuck, the double swallow, or thickening liquids. Here's some of my references, and thank you for listening.